Anterior and posterior area-specific curettes. Gracey Curettes. Presentation and videos created by Lori Close. Gracey Curette video recorded by Tanya Morley. Instrument photographs, Jenna Close. This presentation includes photographs from Fundamentals of Periodontal Instrumentation, Joe S. Gehrig. Purpose of this presentation. Review proper patient and operator positions. Review instrument design characteristics for Gracey Curettes. Identify area of use for Gracey Curettes. Identify the correct working end of Gracey Curettes for anterior teeth. Identify the correct working end of Gracey Curette for posterior teeth. Compare the Gracey Curettes to the universal curette. Review visual cues. Demonstrate correct angulation of the Gracey Curettes. Demonstrate correct adaptation of the Gracey Curettes. Identify how to move the working end of the Gracey Curettes. Identify characteristics of the instrument stroke. Identify characteristics of the bite stroke, the calculus removal stroke. Differentiate between anterior and posterior Gracey Curettes. Identify the correct cutting edge, useful or lower cutting edge. Compare Gracey Curette designs, including standard, rigid, extended lower shank, miniature working end, micro-miniature working end. Operator seating positions for use of Gracey Curettes on anterior teeth. Maxillary and mandibular anterior surfaces toward. Right hand dominant 8 to 9, left hand dominant 3 to 4. You may find that the 9 o'clock position for right hand dominant operators and the 3 o'clock position for left hand dominant operators works best for maxillary anterior surfaces toward. You may find the 8 or 8:30 position for right hand dominant operators or the 3:30 or 4 position for left hand dominant operators works best for mandibular anterior surfaces toward. Maxillary and mandibular anterior surfaces away. Both the right hand dominant and left hand dominant operators will sit between the 11 and 1 o'clock position. Most operators choose 12 o'clock. A hint: change operators' seating positions and end selection of the Gracey anterior curette when going from surfaces toward to away. Operator seating positions for use of the Gracey Curettes on posterior teeth. Maxillary and mandibular posterior surfaces toward the operator. The right hand dominant operator would sit at 9 o'clock. The left hand dominant operator would sit at 3 o'clock. This position is required for sextant 1 buccal right hand dominant operator and sextant 3 buccal for left hand dominant operator. Operators are allowed 1/2 hour adjustment in basic seating positions for surfaces toward them. Most right hand dominant operators will choose 8:30 for all other posterior surfaces toward them. Most left hand dominant operators will choose 3:30 for all other posterior surfaces toward them. Maxillary and mandibular posterior surfaces away from the operator. All posterior surfaces away from the operator for right-hand dominant operator will sit between 10 and 11, and the left-hand dominant operator will sit between 1 and 2. Review of instrument design. The face. The face is the top of the working end. The face tilts at approximately a 70-degree angle to the lower shank. One cutting edge is lower than the other in relation to that lower shank. The tilted face means the lower cutting edge is self-angulated. The face is yellow in the diagram. Back. The back is the bottom of the working end. For Gracey Curettes, the back is rounded. The toe. The toe is the end of the working end. The toe 1/3 of the working end is locked onto surfaces for calculus, tooth surfaces for calculus removal. Cutting edges. Cutting edges are formed where the face and lateral surface meet. Gracey Curettes are area specific, meaning there is only one useful cutting edge, the lower cutting edge. Lower or useful cutting edge. The lower cutting edge is automatically at the correct angulation when the lower shank is parallel to the tooth surface to be instrumented. Cross section. Gracey Curettes are semicircular in cross section. Instrument design. The MATC Process 1 instrument kit contains 4 Gracey Curettes. The 1-2 standard or flexible Gracey Curette. Area of application, anterior teeth, all tooth surfaces. The 3-4R or rigid Gracey Curette. Area of application, anterior teeth, all tooth surfaces. The 11-14 standard flexible Gracey Curette is paired different than the original Gracey series. Area of application for the Gracey Curette number 11, the posterior teeth, facial, lingual, and mesial surfaces. Area of application for the Gracey Curette 14, posterior teeth, distal surfaces. The 12-13 standard flexible Gracey Curette again is paired different than the original Gracey Curette series. Area of application for the Gracey Curette 12, posterior teeth, facial, lingual, and mesial surfaces. Area of application for the Gracey Curette 13, posterior teeth, distal surfaces. Standard or flexible Gracey Curettes are used to remove light calculus and or biofilm. Rigid Gracey Curettes are used to remove medium or moderate size deposits. There will be an R stamped on the handle of the Gracey Curette if it is a rigid. After using a Gracey Curette, the clinician will always follow up with a standard flexible Gracey Curette to finish or smooth the area. Gracey Curettes are area-specific curettes. Gracey Curettes are designed for subgingival calculus removal, but can be used supragingival or supramarginal. Review of instrument design. Functional shank for anterior and posterior Gracey Curettes. The functional shank is the portion of the shank that allows the working end to be adapted to the tooth. The functional shank is colored in yellow or light green on the 2 top photos. The first photo is of an anterior Gracey. The second photo is of a posterior Gracey. We can tell that by the contra angle or bend in the shank. The lower or terminal shank. The lower or terminal shank is the section of the functional shank that is nearest the working end. The lower shank is colored in purple on the bottom two photos. The probe is positioned on the lower or terminal shank on both of the anterior and posterior Gracey curettes in the photos. It is important to be able to identify the lower shank, as the lower shank is kept parallel to the tooth surface you are working on to maintain proper angulation. This is a very important visual cue. Review of instrument design. The anterior Gracey curettes are area specific. The lower cutting edge will adapt to either surface toward or away. One end of the anterior Gracey will adapt to surfaces toward, while the other end will adapt to surfaces away. Your cassette contains a Gracey 1-2 curette and a Gracey 3-4R or rigid curette. The 1-2 is a standard flexible Gracey curette used to remove light calculus and biofilm. The 3-4R Gracey curette has a rigid shank to remove moderate calculus. The clinician will follow up with a 1-2 flexible or standard Gracey after the use of the 3-4R for anterior teeth. If you look in the photo, you can see that the shank on the 3-4R is thicker or heavier than it is on the flexible 1-2. Review of instrument design. Posterior Gracey curettes, area specific. The MATC Dental Hygiene Program has paired your posterior Gracey curettes different than the standard pairing. The 11 and 12 ends of the Gracey curettes are used for instrumentation on direct facials, linguals, and mesial surfaces of posterior teeth. The standard design is to have an 11 on one end of the instrument and a 12 on the other. The 13 and 14 end of the Gracey curettes are used for instrumentation on distal surfaces of posterior teeth. The standard design is to have the 13 on one end and the 14 on the other. At MATC, we have paired the 11 with the 14 and the 12 with the 13. In some sextants, the 11-14 will adapt to all surfaces of the posterior tooth from the buccal, while the 12-13 will adapt to all surfaces of that same tooth from the lingual. In other sextants, the 11-14 will adapt to all surfaces of the posterior tooth from the lingual, while the 12-13 will adapt to all surfaces of that same tooth from the buccal. It is not recommended to memorize the sextants each instrument works in. It is better to be able to recognize the end selection while viewing the instruments from your cassette. Instrument design of posterior Gracey curettes. Gracey 11-14 and 12-13 curettes. The lower cutting edge or useful cutting edge of the 11 and 12 Gracey curettes are located on the outside. The outside cutting edge is further from the handle, as is shown in the top two photographs. The probe is pointing to the outside. The lower cutting edge or useful cutting edge of the 13 and 14 Gracey curettes are located on the inside. The inside cutting edge is closer to the handle, as is shown on the bottom two photos. The probe is pointing to the inside. The way MATC has paired your instruments, 11-14 and 12-13, each instrument will have a lower cutting edge on the inside and one on the outside. A hint: when looking at your instrument cassette, the 13 and 14 ends, used for instrumentation on distal surfaces, are more contra-angled or angled than the 11 or 12 ends. You can also see that in the photos off to the right. The Gracey Curette series. Standard Gracey Curette series, area-specific curettes. Dr. Clayton Gracey developed the original series of 14 single-ended instruments that could reach root surfaces in deep periodontal pockets without causing trauma to the epithelium. Today, most of these original 14 single-ended instruments are paired, creating 7 double-ended instruments. For example, the 1-2 Gracey, 3-4, 5-6, 7-8, 9-10, 11-12, and 13-14. Gracey Curettes. Newer additions to the Gracey Curette family. The Gracey 1516 has more of a contra angle and is designed to be used on posterior teeth, facial, lingual, and mesial surfaces. The Gracey 1718 has more of a contra angle and is designed to be used on posterior teeth, distal surfaces. The extended lower shank. The lower shank is 3 millimeters longer, allowing you to reach into deeper pockets. Miniature working end. The working end length is decreased by 50% compared to the standard. So the working end is decreased by 50%, making it much shorter. The micro miniature working end, the working end length is decreased by 50% compared to the standard, and the working end width is decreased by 20% compared to the miniature working end. Hint: any Gracey curette can be fabricated to have a rigid shank, an extended lower shank, a rigid extended lower shank, a miniature working end, a micro miniature working end, or a combination of any of these. Comparison of the Gracey curettes to the universal curette. Similarities: both have rounded back and toe. Adaptation is the same. Use your visual cues. Both are curettes and are designed to be used subgingival, but may be used supragingival. The calculus removal stroke, the bite stroke, for both the universal and Gracey curette is an up and away direction. The assessment strokes are the same. They are feather light, little pressure is used, and they are overlapping. The universal curette and any rigid Gracey curette can be used to remove moderate calculus. Differences: the universal curette is used for moderate calculus removal and can be used for light, while the standard flexible Gracey curettes are used to remove light calculus. To achieve proper angulation, the lower shank of the universal curette needs to lean slightly into the tooth surface you are working on, while the lower shank of the Gracey curette needs to be parallel to the tooth surface to achieve proper angulation. Gracey curettes are area specific, while the younger good 7-8 is universal, meaning has 2 useful cutting edges on each end of the curette and can be used throughout the mouth. How to determine the correct end selection of the Gracey 1-2 or 3-4R curette on an anterior tooth. The toe is directed interproximally. The back of the working end is towards the gingiva. The lower cutting edge is against the proximal surface, surfaces toward or away, that you are working on. The lower shank is parallel with the proximal surface, surfaces towards or away, that you are working on. How to determine the correct end selection of the Gracey 1-2 or 3-4R curette on an anterior tooth. Refer to Blackboard to watch the video on end selection of the Gracey curette on an anterior tooth. Go to the Videos tab, Learning Plans 16 and 17, Gracey curette, anterior Gracey curette end selection. How to determine the correct end selection of a posterior. How to determine the correct end selection of the Gracey 1114 or 1213 curette on a posterior tooth. The tooth is directed interproximally. The back of the working end is towards the gingiva. You have chosen the 13 or 14 end of the Gracey curette. Think more contra-angled. The functional shank goes up and over the distal of the tooth. The lower shank is upright and parallel to the distal surface of the posterior tooth. The inside or inner cutting edge is adapted to the distal of the posterior tooth. The handle is towards the midline. The first picture is of the correct end selection. The second picture is of an incorrect end selection. The functional shank is going down and around the tooth in the photo, down and around. This is incorrect end selection. How to determine the correct end selection of the Gracey 1114 or 1213 curette on a posterior tooth. Please refer to Blackboard to watch the video on end selection of the Gracey curette on a posterior tooth. Go to Videos tab, Learning Plan 16 and 17, Gracey Curettes, Posterior Gracey Curette End Selection. Use of the Gracey curette on an anterior teeth. The lower cutting edge adapts to the anterior tooth surface. Divide the tooth in half and start at the midline. The toe leads into the direction you are going. When changing from surfaces toward to away, the clinician will change the end selection of the anterior Gracey curette and operator chair position. Use of the Gracey curette on posterior teeth. You have chosen the 13 or 14 end of the posterior Gracey curette. The inside cutting edge adapts to the distal of the posterior tooth surface. The lower cutting edge is chosen. Placement is slightly mesial to the distal line angle. The toe leads into the direction you are going. Upon completion of the distal surface, you change ends of the instrument and choose the 11 or 12 end of the posterior Gracey curette. You have chosen the outside cutting edge, which is the lower cutting edge. The toe leads to the direction you are going. Placement is slightly distal to the distal line angle. You complete the direct facial, lingual, and mesial surfaces. A review of visual cues for correct adaptation of the Gracey curettes. How do you determine you have the terminal 1/3 of the working end adapted to the tooth surface? The heel will be rotated or rolled away from the surface you are instrumenting. How do you determine if the back of the tip is directed apically when instrumenting proximal surfaces? The answer: the lower or terminal shank should be upright with the tooth and lean into the tooth in a facial and lingual direction. How do you determine if you have instrumented halfway or more across the interproximal? The lower or terminal shank will be positioned at or past the line angle. Again, this will depend on the length of your working end. Relationship of the face to the lower shank. Comparing the scalar, universal curette, and area-specific curette. The face of the sickle scalar and universal curette is at a 90-degree angle to the lower shank. The cutting edges on these instruments are level, and both cutting edges are useful. The face of the area-specific curette is tilted in relationship to the lower shank. That is shown in blue, the area-specific curette. The tilted face causes one cutting edge, the useful cutting edge, to be lower than the other cutting edge. The face of the area-specific curette is at a 70-degree angle to the lower shank. Visual cues for correct angulation of the Gracey curette. Gracey curettes are self-angulated. The lower or useful cutting edge is automatically designed to be at the correct angulation for periodontal instrumentation when the clinician keeps the lower shank parallel to the tooth surface being instrumented. This differs from the universal curette as the lower shank on this instrument needs to lean slightly into the tooth surface to maintain angulation. So for Gracey curettes, to maintain the angulation, the lower shank will be parallel to the root surface or tooth surface. For universal curettes, to maintain the angulation that we need, the lower shank will need to lean into the tooth or root surface that you are working on. Moving the working end of the Gracey curettes. Wrist activation is recommended. Instrumentation occurs in short millimeter movements. Assessment and reassessment strokes are light. Calculus removal stroke, the bite stroke, requires firm lateral pressure, locking the toe against the tooth, and wrist activation. The calculus removal stroke, the bite stroke, is an up and away motion. Pause and rest between bite strokes. Preparation for instrumentation with Gracey curettes. These steps should be very familiar to you by now. You have used most of these steps with the probe and explore, and all of these steps with scalers and the universal curette. Me. Am I at the correct operator position? My patient. Is my patient's head in the correct position? Have they turned toward or away from me? Does the headrest need to be adjusted up or down? My equipment. Is my light and delivery system in reach? Think ergonomics. My non-dominant hand. Do I have a stable fulcrum? Do I have a proper grasp with my mirror? My dominant hand. Do I have a modified pen grasp? My finger rest or fulcrum. Have I established a secure fulcrum? Is it close to the tooth I am working on, yet out of my line of fire? My adaptation. Have I adapted the toe 1/3 to the tooth surface? My angulation. Is my lower shank parallel to the tooth surface that I'm working on? My stabilization. Am I pushing against the tooth with my fulcrum finger and applying inward pressure against the handle with my index finger and thumb? My activation. The bite stroke is an up and away motion, short and controlled stroke. Rest my muscles. At the end of a bite stroke, I pause briefly to relax my fulcrum finger, index finger, and thumb. And my next stroke, I continue to either reassess, initiate another bite stroke, or move to assess the next area. All assessment strokes are light. The only time I add any pressure is when I'm going to do a bite stroke. Stroke direction used with Gracey curettes. Vertical strokes are most commonly used on all surfaces of anterior teeth and proximal surfaces, mesial and distal, of posterior teeth. The first photograph shows a vertical stroke. Oblique strokes, most commonly used on facial and lingual surfaces of posterior teeth. The second photo shows an oblique stroke. Horizontal strokes, most commonly used at the line angles of posterior teeth and the midlines of facial and lingual surfaces of anterior teeth. In process 1, we will practice horizontal strokes on the maxillary and mandibular anteriors at the midline from the facial and distal line angles of posterior teeth from the buccal. the horizontal stroke on anterior teeth using a Gracey Curette. Right hand and left hand dominant operators sit at the 12 o'clock position. The horizontal stroke is at the midpoint of the tooth on the facial surface. The lower, or useful, or working cutting edge will be adapted to the tooth surface. The lower shank crosses the facial surface, is horizontal to the tooth surface. The fulcrum is on the facial surface, on tissue, not on hard tooth surface, and further away from the tooth. This will be a new experience for you because we've had you have your fulcrums very close and on hard tooth surface. Now we're asking you to fulcrum on the tissue and further away. Close the angle of the instrument to insert at a 0 to 40 degrees, making sure that the toe is at 1/3 is adapted. The toe will not insert to the attachment. Angle the instrument by opening the instrument to 70 to 80 degrees. Adapt the instrument again by rolling the heel. Tighten the grasp. The horizontal bite stroke will be a 1 millimeter effortless bite up and away from the facial surface. No assessment or reassessment strokes are used in process 1. The horizontal stroke on posterior teeth using Gracey Curettes. The operator sits at the position that is standard for the tooth to be instrumented. The horizontal stroke is at the distal line angle of the tooth on the buccal surface. The outside, lower, or useful cutting edge will be adapted to the tooth surface. That will be either the 11 or 12. The lower shank crosses the buccal surface, is horizontal to the tooth surface. The fulcrum is on the buccal surface on tissue, not on hard tooth surface, and further away from the tooth. So again, fulcrum is now going to be on tissue and further away than you have been used to. Close the angle of the instrument to insert 0 to 40 degrees, making sure the toe 1/3 is adapted. The toe will not insert to the attachment. Angle the instrument by opening the instrument to 70 to 80 degrees. Adapt the instrument again, roll the heel, tighten the grasp. The horizontal bite will be a 1 millimeter effortless bite up and away from the facial surface. No assessment or reassessment stroke are used in process 1. Sequence for instrumentation with the posterior Gracey Curettes on posterior teeth. You should be checking all of the following: me, my patient, my equipment, my non-dominant hand, my dominant hand, my finger rest, dry the tooth surface, verify correct instrument and end selection, either the Gracey 1114 or 1213. Begin just mesial to the distal line angle. You'll be using the inside cutting edge. The toe is directed towards the distal. Change the end of the instrument to use the outside or lower cutting edge for the buccal, lingual, and mesial surfaces. Toe will now be directed towards the mesial. Sequence for instrumentation with posterior Gracey Curettes on posterior teeth. Begin with the toe 1/3, last 1 to 2 millimeters of the working end, adapted to the tooth surface. Insert the cutting edge is at a 0 to 40 degree angle to the tooth surface. The lower shank will lean into the tooth surface. The instrument will need to go to the base of the pocket. The grasp will be very light or feather light. Angle. The cutting edge will now be open to 70 to 80 degree angle to the tooth surface. Opening is minimal. The lower shank will now be parallel to the tooth surface. Grasp is still very light. Adapt, the toe third, last 1 to 2 millimeters of the working end. Angle and adapt are done simultaneously. Adapt only if necessary. Assess, explore coronally only. Grasp will be light. Sequence for instrumentation with the posterior Gracey Curette on posterior teeth. If calculus is found on the assessment stroke, the clinician will continue with an activation or bite stroke. To do the bite stroke, you should check your angulation, 70 to 80 degrees. Check your adaptation, the last 1 to 2 millimeters of the working end. Your fulcrum, are you close but not in your line of fire, yet stable? The grasp, no splitting of your grasp. You should have an open window between the index and thumb and a modified pen grasp. Tighten grasp slightly. Place even pressure between your index finger and thumb. Place slight pressure on your fulcrum. Lock the toe 1/3, 1 to 2 millimeters of the working end onto the tooth surface. The working stroke is a 1 millimeter effortless bite stroke up and away from the tooth surface. Rest and lighten your grasp. Reassess the area by insert, which is closing the angle to 0 to 40 degrees, and insert to the base of the pocket. Angle, opening the angle to 70 to 80 degrees. Adapting if necessary, and reassess with a light grasp. If calculus remains, continue with all of the steps of the bite stroke. Remember, every time you go apically, you must close to insert your toe. Grasp is always light, only slightly tightened when doing a bite stroke. Sequence for instrumentation with anterior Gracey Curettes on anterior teeth. Again, you should always check the following: me, my patient, my equipment, my non-dominant hand, my dominant hand, my finger rest. Again, dry that tooth surface. Verify correct instrument and end selection, this time being either the Gracey 1, 2, or 3, 4R. Begin at the midline. Adapt the lower cutting edge. The toe is directed to the proximal surface you'll be working on. Change end selection and operator chair position, going from surfaces toward to surfaces away. Sequence for instrumentation with anterior Gracey Curettes on anterior teeth. Begin with the toe 1/3, last 1 to 2 millimeters of the working end, adapted to the tooth surface. Insert the cutting edge is at a 0 to 40 degree angle to the tooth surface. The lower shank will lean into the tooth surface. The instrument will need to go to the base of the pocket. The grasp will be very light, feather light. Angle. The cutting edge will now be open to 70 to 80 degree angle to the tooth surface. Opening is minimal. The lower shank will now be parallel to the tooth surface. Grasp is very light. Adapt. Toe 1/3, the last 1 to 2 millimeters of that working end. The angle and adapt are done simultaneously. Adapt is only if necessary. Assess, explore coronally only. Grasp will be light. Sequence for instrumentation with the anterior Gracey Curette on anterior teeth. If calculus is found on the assessment stroke, the clinician will continue with an activation or bite stroke. To do a bite stroke, check your angulation, 70 to 80 degrees. Check your adaptation, the last 2 millimeters of the working end. Fulcrum, close, not in your line of fire, but stable. Grasp, no splitting of the grasp. You have the open window between your index and thumb and a modified pen grasp. Tighten your grasp slightly. Place even pressure between your index finger and thumb. Place slight pressure on the fulcrum. Lock the toe 1/3, 1 to 2 millimeters of the working end, onto the tooth surface. The working stroke is a 1 millimeter effortless bite stroke up and away from the tooth surface. Rest, lighten your grasp. Reassess the area by insert. Close the angle to the 0 to 40 degree to insert to the base of the pocket. Angle, open the angle to 70 to 80 degrees. Adapt if necessary and reassess with a light grasp. If calculus remains, continue with all of the steps of the bite stroke. Remember, every time you go apical, you must close to insert your toe. Grasp is always light, only slight tightening when doing a bite stroke. The end. I hope you enjoy working with your Gracey Curette.